The gallbladder is evaluated for size, shape, wall thickness and appearance, and contents. The presence and number of abnormalities can indicate the presence and progression of gallbladder disease. To begin the ultrasound exam, the transducer is placed on the patient's right side of the xiphoid in a ventral midline sagittal position and angled cranially to find the liver. Then, with the diaphragm to the left side of the ultrasound screen, depth is increased or decreased till the liver fills the ultrasound screen from the top to the bottom. By adjusting depth to fill the ultrasound screen with liver, all normal animals, regardless of actual size or body weight, will have a similar relative size and appearance on the ultrasound screen. Now, fan to the patient's right side and find the long axis of the gallbladder. It may be necessary to rotate the transducer to an off-sagittal position to line up with the long axis of the gallbladder. At this point, the normal gallbladder is estimated to fill about half of the depth of the liver, from the top to the bottom of the ultrasound screen. Most ultrasound machines have a calculations package that allows you to get a measurement of gallbladder volume. In a sagittal or long axis view of the gallbladder, measure length in centimeters from cranial to caudal. Next, measure height in centimeters from ventral to dorsal. Then obtain a transverse or short axis view of the gallbladder and measure width in centimeters from right to left. These three values are multiplied together and then multiplied by 0.52 to give gallbladder volume in cc's. In dogs, normal fasting gallbladder volume is about 1 cc per kilogram of body weight and should decrease in size by 25% or greater within 2 hours of eating. This video showed a volume measurement of 93.7 cc's in an 81-pound or 37 kilogram male Labrador with PU, PD, and elevated liver enzymes. Gallbladder volume was expected to be 37 cc's. Ultrasound also showed an enlarged liver and a left adrenal tumor. Normal cats have a gallbladder volume measurement of 2.5 to 7 cc's. Borderline measurements are probably normal. Measurements smaller than expected suggest recent gallbladder emptying or decreased bile flow from liver lobes. Gallbladder volume of greater than 10 cc's is considered abnormal in cats. This cat's gallbladder is off-sagittal in orientation, and the cat has a normal volume of 7 cc's. Some ultrasound machines allow the volume calculation to be made using two separate screens. Gallbladder length and height are made from a sagittal or long axis view, and width is made from a short axis view. Other ultrasound machines require a dual screen view of the gallbladder in long and short axis. First, obtain a sagittal or long axis view of the gallbladder, and then select dual screen. Push the freeze button and use cinematic loop to select the best image. Then, activate the second screen by pushing the update button. Get a short axis view of the gallbladder, push the freeze button, and use Cinematic Loop to select the best image. Activate the Calculations package and select Volume. In the long axis view, measure gallbladder length and height. In the short axis view, measure width. The ultrasound machine will calculate volume in cc's.